Preparing your patient for surgery, inpatient process. The physician will call the house supervisor to schedule the case. The house supervisor will schedule the case in Epic and then notify staff. If the patient is not yet admitted, they will report to the ER admitting desk and state,
"I'm checking in for my scheduled procedure."
Remember, this is for after-hour, weekend, and add-on inpatient cases. Admitting staff will call the house supervisor for the patient room number and then proceed to escort the patient to their assigned room. They will notify nursing staff of the patient arrival. The nurse will then prepare the patient for surgery. These nursing tasks can be found in Epic. Log into your patient chart. Click the More button in the bottom left-hand side of your screen. Next, click the star next to Pre-Procedure to add to your favorites. You will only have to do this once. Now that you have added Pre-Procedure to your sidebar, you can click to open more options. Now click Pre-Procedure Checklist. Complete all tasks as they apply to your patient. If it does not apply, click the NA option. Let's go through each item on the checklist. First, you will document the NPO status. This requires the date and time of the patient's last food or full liquids, and then clear liquids. Notify the surgeon and anesthesiologist if it falls outside of the guidelines. Now let's look at Advanced Directive. You must document in one of the following fields to meet the required documentation rules. Notice the guidelines to help you select the option that applies to your patient. Moving on to patient chart verification. Click the methods in which you have verified your patient and the armbands that apply to your patient situation. Next, make sure your patient voids just prior to going to their procedure and then document the time. An H&P must be documented within the last 30 days and an interval note within the last 24 hours. Double check to ensure all pre-op orders have been released at least 3 hours prior to the surgery start time and complete them as ordered. Document if blood is ordered. The surgical consent contains the blood consent and refusal. Document according to your patient situation. For your patient's safety, remove all jewelry, piercings, undergarments, and ensure they are in a snap or bear hugger gown. You made it to the last task, which is verification of the procedure. Make sure there is a signed consent and that it matches what has been scheduled in Epic. The surgical site must also be verified by the surgeon and marked according to our policy. Thank you for providing quality, efficient, safe patient care.